Greetings. Let us learn about hot snare with a special reference to how to use a hot snare for pedunculated polyp resection. Here is a patient who was referred to us for removal of this large pedunculated polyp with a thick stalk in the sigmoid colon. This polyp has a high risk for bleeding because the polyp stalk will have multiple large feeding vessels. So in order to remove this polyp, one should use a hot snare. Cold snare does not work here. And when it comes to using a hot snare, the patient should be connected to the electrosurgical unit with the placement of a returning electrode on the loin and attached to the neutral socket, and the active electrode from the monopolar outlet to the hot snare socket. It's also important to make sure that the electrosurgical unit is not hiding behind the endoscopist, but it should be in front of the endoscopist so that the parameters that are set up for resection are easily visible. And before hot snare resection, it is important for the assistant to share with the endoscopy team what settings are there on the machine. For example, endocut Q313, force coagulation, effect 2, 25 watts, so that the endoscopist and the team know the settings that are being used to resect a polyp. This is really critical. And before anything is done, it is also important to keep the foot pedal that will activate the electrosurgical unit close to the endoscopist so that you're not trying to find that foot pedal once the snare is around the polyp. All these things should be done before the snare goes into the endoscopy channel. So, important to keep the electrosurgery unit in front and not behind. And when it comes to pedunculated polyp resections, it is important to use coagulation current instead of cut current, because forced coagulation current will allow the sealing of large feeding vessels. Different endoscopists use different types of settings. I prefer to use effect 2, 25 watts. Sometimes you can increase the wattage. The Japanese have been using 30, 35 watts. And you activate the pedal for force coagulation by pressing on the blue pedal. This will be done by the endoscopist. So the pedal should be very close to the endoscopist's feet so that he could press on the pedal without searching for that. By pressing on the blue pedal, the electrosurgical unit delivers coagulation current. So now let us look at how to use a snare, especially when you're managing or resecting a large, thick-stalked pedunculated polyp. As you can see here, once the snare is completely closed with the thumb ring and the slider close together, the snare wire is enclosed inside the plastic sheet by a few millimeters. Once you open the snare by pushing the slider forwards, the snare loop comes out. And then gently close the snare to enclose the loop so that the tip of the snare loop is at the tip of the plastic sheath, and mark on the slider where the slider with the rings is, so as to know that is the position where the snare tip is at the plastic sheath tip. So why is this important? When you look at the top image, you have say for example, a polyp which is about maybe 8-9 millimeters in thickness. The stalk is 8-9 millimeters thickness. And when you open the snare and close the snare in the middle figure, and if it corresponds to 8-9 millimeters thickness that you estimated, you can be assured that you did not trap anything extra. On the other hand, sometimes if the polyp is around a bend and you're closing the snare and you catch a fold of tissue as seen in the bottom figure, and then you measure the distance on the slider is longer than you expected looking at the stalk, then you have to think twice before you apply current so as to avoid unnecessary additional tissue damage. So for this reason, it is important to mark on the snare, especially when you're resecting thick pedunculated polyps. It is an additional step, but from safety point of view, it gives you another safety margin. When it comes to pedunculated polyp resection, do not apply snare close to the base because the thermal injury will go through the wall of the colon and can cause severe bleeding, and the vessel that is transected may retract and you may not be able to catch that even with clips. That's one. Another issue is colon wall is very thin, between 3 to 5 millimeters in thickness, and deep thermal injury by applying the snare close to the base of the stalk of the polyp could result in transmural thermal injury and delayed perforation. For this reason, instead of applying the snare close to the base of the stalk of the polyp, one should attempt to place it a little bit up, about in the middle of the stalk, and it should be tightened, and then coagulation applied so as to coagulate the blood vessels and transect the polyp stalk. With a large thick pedunculated polyp in the sigmoid colon, sometimes the colon polyp is touching the adjacent wall. As long as the opposite wall is being touched by the polyp over a broad surface area, there should not be any problem because the thermal injury and the current travels through the narrowest portion at the stalk. On the other hand, if the polyp head touches to a smaller area than the area that is being closed by the snare, current will flow through that area and result in a counter burn. Hence, when you are resecting a large pedunculated polyp in the narrow confines of a sigmoid colon, it is important to have a broad contact of the head of the polyp to the opposite wall instead of a narrow point. And also, it is a good practice to move the snare in and out so as to change the contact area of the polyp to the wall in such a way that it is not fixed at one point. If in case there is a clip in the adjacent area, be careful not to send the current through the clip to the adjacent wall. Also, it's important not to tent it too much to the point of making the polyp stalk below the snare much thinner. That's where the current density will be maximum and the cut will happen there. Also, when closing the snare, one should apply a tight squeeze of the snare, and as the endoscopist is applying the foot pedal and applying electrosurgery, the snare should constantly keep closing so as to deliver the current and cut. If you do not close at an appropriate speed and more current is going through the wall of the colon, there is likelihood of delayed perforation. For an endoscopy assistant who is closing the snare and participating actively, learning to see the effects of current going through the stalk and the cut happening and adjusting the speed of the cut is very important. If you do not learn how to close the snare properly, injury to the wall and perforation can result. So the endoscopy assistant should learn this technique and practice it to perfection. So coming to the complications of a hot snare, one complication is bleeding. If you don't close the polyp stalk, if you close the polyp stalk too tightly and the cut happens too fast before the coagulation of the blood vessels, there could be immediate bleeding. And on the other hand, if it closes too slowly and there is too much of charring and coagulation, sometimes the scab can come off and present with delayed bleeding. If immediate bleeding were to happen, one should be ready to have epinephrine injection, clips, and loops readily available for managing that bleed. So as an endoscopy assistant, when you're assisting a pedunculated polyp resection, make sure that you have your injection needle ready, your loop, endo loop ready in the room, and clips ready in the room, so that if there were to be a problem, you are not trying to find those pieces of equipment that are not available in the room and you're going out of the room. That's not a good idea. Make sure that you have all the equipment in the room and have them available on the back table. Another complication is perforation, and perforation of a pedunculated polyp resection is very rare as long as you follow the principles of resection, applying the snare in the middle of the stalk away from the base and closing the snare loop very tight and progressing with the loop closer at a speed that would allow the cut to happen while coagulating the vessels and not allowing too much current going through the wall of the colon causing perforation. Thank you.